Good afternoon. Confirm I am audible. Moses, you can confirm from your end if I am audible.
Yes, you are, Marianne.
All right. Yes. Because of time, I think we can proceed. We request that you continuously reach out to your colleagues, share the links that we have shared with them to assist them to join. For those that are experiencing challenges using Teams, we have shared our live YouTube channel that has the same training, so they can be able to follow from there. So welcome everyone. This second day of this particular training scheduled. All protocols observed. Welcome the county teams on call, the facility teams on call, the partners on call, and our colleagues from Palladium. Yesterday, we managed to finish the first session and covered some introductory parts. Today, so yesterday, what we managed to look at was to orientate the users on the system access practices and system modules navigation, where we looked at just a highlight or an overview of the modules that we currently have. Then we looked at in-depth on how to onboard a patient. So today, we also want to do the same, more or less an orientation. We are going to have focused modular level trainings in upcoming trainings. So today what we want to do is to orientate the users using Kenya EMR on specific clinical workflow changes, and more specific how to access program-specific forms, how to retrieve data, how to report, and also how to look at some administrative tasks that will help us to be able to access program forms and also perform the specific workflows. So we're going to look at that. We're also going to look at machine learning, a bit of machine learning. We have some improvements on that we're going to just communicate, and we can also see the new changes there. We'll also do some highlights on system administration tasks that are required to be done previously before users use this system, and also continuously, so that we can be able to generate reports and look at our data that we are documenting on a daily basis using the system. So to start us off, we're going to start with the clinical workforce flows. We're focusing specifically on the HIV clinic, that is all the way from HTS prep, HIV, and MCH. For this particular session, we will not focus on outpatient. So to do that, allow me to share my screen so that we can review the system together. So there's some questions again we would like to answer today to help us to be able to understand the clinical workflows within the new TaifaCare EMR version. One will be looking at what is the eligibility criteria for somebody to be enrolled in a specific program. How do we enroll a client or a patient to a specific program? How do we access program-specific forms? And highlight some of the changes for these particular sections. So starting with, for us to be able to answer these questions, I'm going to use a few patients that are already existing in the system so that we do not take so much time. So for example, we're going to look at the eligibility criteria. So for a patient or a client to be eligible to be enrolled in a specific program, this is usually dependent on gender, that is sex, age, and conditions that a particular client may have. So we can model and see how this enables somebody to be eligible. So I'm going to start with one patient, for example, a male patient. so that we can see how gender influences eligibility. So for example, I'm using this patient as my test patient to showcase one, programs that our patient may be eligible for, and two, how we are going to enroll our patients to the eligible programs and how to access the forms. So currently when you log in and you can be able to access the patient homepage, we went through this yesterday. This is a view of the patient homepage. From the patient summary, we have several tabs, one of them being the care panel. So the care panel is where we will be able using the panel summary. And we can also now be able to enroll our patients to programs where they're eligible using the program enrollment tab. So for example, for a patient who is a male patient, 45 years of age, they are eligible for these specific programs. We can be able to enroll them to HIV clinic if they meet the criteria of being a HIV patient, violence screening, just to mention a few. So for example, you will find because of his gender, he is eligible for being enrolled to a specific program that we will not find when we go to a client who may be a female client. Sorry, I'm using a female client. Oh, I started with a female, not a male. So for example, my client is female. From the eligible programs, one of the programs that you will find a male client will not be eligible for, but a female client who is an adult is eligible for is one, preconception care. And this is a program that provides specific interventions before a planned pregnancy, and it is geared towards promoting the well-being of the pregnancy and the outcome of the child. So if our patient was a male client, they would not be eligible and would not even be able to find this particular program under this. Same case with something like antenatal care and postnatal care. So there will be specific programs making a patient or a client eligible for them by the virtue of their gender. So that is one of the distinctions that we have. So for example, let us try to enroll our patient to one of the programs just to see what happens. So for each and particular program, there is a section that allows us to be able to enroll. So when you click on the enroll button, it gives us a specific program form for enrollment. For example, we've clicked on preconception care enrollment, and the system is going to load the form that will allow us to enroll our patient to this program. So you'll find in most of these programs, the enrollment form will be almost the same because it is going to auto-pick visit details, the provider and location from the system. And the only thing a user is required to do is just to save and close. When we do that, we'll find that now among the programs that we had, the status has changed. Our patient is no longer eligible for this particular program, but they are now, the status has changed to enrolled. And if we were to even go back to the panel summary, now we'll be able to see preconception care is one of the programs that our patient has been enrolled to. We can be able to access the date they were enrolled, and even some things we can be able to do. We can either edit the enrollment form if we did not capture something correctly, maybe the date was picked wrongly, and we can also discontinue someone from the program from the panel summary if we are no longer managing them in care for this particular program. So going back to the program enrollment, one, we've been able to find out where to access program enrollment within the EMR, patient homepage, patient summary, care panel, program enrollment. Then we click on the enroll button and enroll and save the form. So how do we access now specific forms for this particular program that we have enrolled our patient to? So against each program again, where we have status enrolled, at the far end, we have 3 dots, options. So this is where the system will load for us all the forms that are needed to be filled on a specific time for our patient. For example, we can be able to see we can get the preconception care form, we can get the preconception discontinuation, and we can even delete this particular enrollment on a need basis. So for some workflows, you will find, we'll be able to see this as we move on. You will find that the first form you find is the first form that is capturing the initial details when we are seeing our patients. And then when we fill that one, consecutively, we will be having follow-up forms. So that is just an example of a patient who is a female, what programs they can be enrolled into, and how to enroll a patient to one program. Let's start maybe for male clients and see. A minute. My system is hanging. So for example, we have this patient who is a male, 59 years of age. So when we are able to access their care panel from the patient homepage, patient summary, care panel, let us see what programs we can be able to see that we couldn't get when our patient was a female. So again, the panel summary has nothing because the patient has not been enrolled to any program. Moving on to the program enrollment tab. Now, these are the specific programs that our patient can be enrolled into, meaning they're eligible if they meet the criteria for that specific program. And over time, we may be able to enroll them in this specific program. So we'll find anything that was specific to a female, like the ANC, postnatal, preconception care, we may not be able to find it for our male client because, again, program enrollment, one of the eligibility criteria is gender. So let's pick one thing that maybe we may not be able to enroll a female, but you can enroll a man. For example, VMMC, one of these programs. Just click on enroll. System is going to give us the enrollment form. Remember, I said that the enrollment form for most of these programs will more likely have only the user saving and closing because it's just going to auto-pick the details from the system, the visit details, the provider, and the location where we're enrolling our patient, and you can save and close. That moves it now to the top of the queue, and the status has changed as enrolled. So once we enroll our patient, for example, this male to VMMC, how do we proceed now to offer them care in the system and document this? Again, against the program where we have enrolled this particular client, where we have options, the three dots are defined, we can access and we can be able to even see a VMMC initial form and discontinuation. So allow me to just fill the VMMC initial form so that we see how the system is also helping the user to have consecutive documentation in terms of the user is being assisted to document records systematically within the system. For example, we have just enrolled. Now we can be able to capture initial VMMC details. I'll just quickly fill the mandatory fields so that we can move quickly. Maybe our client was referred, maybe it was a self-referral. The client type, we can say it's a new patient. The main source of VMMC information, maybe we can say they got this from social media. That's why they came to the facility. Maybe there was a campaign or an outreach somewhere. Then the county, you can just feel like, you can say Kisumu. And we can save and close the initial form. So the system is going to tell you the form has been saved successfully. We have managed to capture some initial details about our patient concerning the VMMC program. So when we go back again to access the forms, you will find now the system has managed to load for you the other forms that you're supposed to fill concerning this particular program. So that means it has to be sequential and you have to fill one thing for you to be able to access the other things. The reason why this has been done this way is so that we do not miss out on any documentation Previously, users would access the clinical forms from the forms icon, clinical forms icon. We could either be able to search or see forms that a particular patient can be filled for, depending again on the programs you have enrolled in. So we are moving away from accessing the clinical forms, and what we are doing and what has been done for most of the programs here is that after enrolling a patient, you will deal with that specific program and you'll only be able to access the forms for entry from this particular point of view, so that we know exactly for this program, this is what I'm supposed to do, and it is sequential. So we've managed to see the difference of some of the programs you can enroll between a male client, a female client. Quickly, we can also look at a child. So having this kind of a patient who is 4 weeks old, again, when we're able to get into the patient homepage from the patient summary care panel, then we'll go specific to the program enrollment. Now we'll be able to see what are the specific programs our child can be enrolled to that we can't even enroll an adult who is either a male or a female. And what stands out here is a child welfare clinic. So that also now confirms to us another eligibility criteria that is used. One is gender and two is age, meaning there are specific programs you can be able to enroll to an adult and even to a child. And again, now when you want to enroll this child to the child welfare clinic, we can enroll them and manage their care for the next 5 years. The same enrollment form can be able to save and close. Then when we do that again from the program where we have enrolled, we'll be able to see what specific forms we can be able to fill for this child. And again, on consecutive visits when they're coming to the facility, we'll also be accessing the forms from the same location. So looking at patients again now, we have looked at the first criteria was gender, the second criteria is age. Now let us look at the criteria where we have specific conditions, specific criteria again that can help, that can make our patient eligible for a program. And we can also make another client or patient not eligible. Talking about, I'm going to use the example of PrEP, because again, remember, for a patient to be enrolled in a program like PrEP, there is a specific criteria they need to meet. There's a specific condition that we need to follow within the system. So for that, I'll also use another patient to showcase this. So I'm going to use this patient called PrEP program eligibility. And for this particular one, for the PrEP program to appear within the system from the care panel, this patient must meet some specific criteria. Again, from program enrollment, we're going to see if our patient is eligible for PrEP. And the reason why we are able to get this particular program here is because the criteria has been met, because a patient is above 14 years. Any patient who is 15 years and below will not be able to access the PrEP program. Then their current weight is above 30 kgs. So that means from the triage form, we can be able to get their weight, which is 60 kgs. They are above 30 kgs, so they meet that criteria. Two, an eligibility screening form was filled, and we can be able to confirm from what was done from the clinical visits. We can be able to tell that an eligibility screening form was done, and there was a need to test the patient, or testing was recommended, HIV testing was recommended. Then two, this patient must have been tested for HIV using a HTS initial form, and the outcome turned out to be non-reactive, or they were not HIV positive, they were HIV negative. Then at the same time, a PrEP assessment, a behavior risk assessment form was also filled to ascertain that one, there's a risk this patient is at risk, and 2, they're also willing to take PrEP. So without meeting this criteria, we will not be able to enroll our patient to the PrEP program. So that confirms that some programs, for you to enroll a patient to some programs, you also need to specifically meet the criteria for that particular program, that like the PrEP program. Again, follows the same procedure. We come to the program enrollment tab. Find the program you want to enroll the patient. We already have the PrEP program visible. Enroll. Save the enrollment form. Then again, now on top, we'll be able to see that this patient has been enrolled in the PrEP program and the status has changed. When you go to access the form, we'll find now the specific forms that we need to fill for our patient. So we'll find again the forms will be aligned for you sequentially. So we'll find the PrEP initial form as the first form to fill. After we fill the PrEP initial form, then it's going to load for us the PrEP clinical form that we need to fill. So kindly, we encourage you to be sequential with the system. Once you fill one form and save, do not forget to come back to the specific program to see what is the next form I am supposed to fill. If it is a form that is specific to this particular visit, then you go ahead and fill it. If it is a form that is specific for the follow-up visit, then you will wait and fill that one. For example, if we have a patient who may be coming in for a transfer in, for example, our patient may be HIV positive and they're coming as a transfer in from another facility. How do we handle such a patient? So again, I'll use a test patient to showcase that so that we can also ascertain program enrollment even from the different programs that we have. So for this, I'm going to use a patient who is a transfer in. Who has been checked into the system, and we can be able to access the patient homepage. Again, when we go to the care panel, among the programs that will be available for enrollment, we are going to have HIV program. Follow the same procedure. Enroll our patient. Save the enrollment form. Then again now, we will be able to access specific program forms from the enrolled program. Then you will find we'll be able now to sequentially fill the forms for our patient. For example, start with the HIV initial form, document our patient as a transferring. I may not be able to document the form, but I'm just going to showcase it. For patient source, our patient is going to be a transferring. If it was a new patient who was being linked into care, again, the patient will be a new patient. Then we'll find when we finish filling this form, let me just fill it quickly. Maybe at the CCC, they came directly to the CCC, that we model this quickly. Transferring date, it can be today. Transfer facility, you just select a facility from here. Allow me to just fill the mandatory fields. Then confirm the HIV positive, maybe in around 2023, sometime in August. And we can save and close. So when we do that, one, we've managed to enroll this particular patient to the HIV program. We've also managed to fill the HIV initial form. So now you'll notice once I have done one form, the system now will allow you to access other forms. For example, now we'll be able to fill maybe the HIV green card for this particular visit. If it was a new patient, we'll start by filling the ART preparation or the ART readiness form and continue filling the other forms. So for the forms now, currently, we have not moved all the forms. For example, for the patients that we are seeing for HIV, we still have some screening forms that you cannot be able to access from here. So they will still be available from the clinical forms icon. For example, for this patient, we can still be able to access the Cage and Craft. We can be able to access the enhanced adherence screening form. We can be able to access PHQ9 and all these other forms, nutrition form, and so on. So we have not moved all the forms to align with a specific program, but for some programs, you'll find the workflow will be completely here, but this is the direction we are moving and this is the transition. So for cases where you may not find a form among this list and you need to fill it for a patient, we ask you to quickly just go to the clinical forms and search for it. If you can't find a form among the clinical forms, then it means it has already been integrated within the specific programs, and all you need to do is to come against that program and access from the 3 dots. So quickly, before I hand it over to the next presenter, you will notice, for example, for a female patient whom has been on care and then maybe started on ANC and who is just coming to deliver right now, we are no longer enrolling a patient to maternity. Let me just search a patient so we can quickly follow the workflow for that. We use one patient here. I can use this one. You will notice that when we come to the care panel, among the programs that you can enroll this particular woman who's maybe coming to a facility to deliver, you will not be able to enroll them to MCH. Previously, we used to enroll a patient to MCH, ANC, select ANC, postnatal or maternity. Currently, that workflow has been changed because what we will do now is to ensure that this patient is coming for labor and delivery services. Labor and delivery services is part of inpatient. So from the patient homepage where we have inpatient, you can see the tab here that is inpatient. One, we will transfer this patient or admit them to the inpatient clinic using this particular tab here. We can request for admission, record admission requests by clicking on that button. It should load for us the form for recording an admission request. Then from there, we will be able now to access the inpatient details for our patient. I don't know, there's something wrong with my system. Allow me to use a patient whom we had done this for. Let me use my backup patient for this. 1 minute. Sarah. Let's get them from inpatient. So once the form loads, it gives you an option of requesting for admission. It only has like 2 questions where it is asking you just to request for admission. And when you do that and save the form, what it does, it queues that person to the admission module. So again, from TaifaCare, when we go back to our modules, one of the modules we have is admissions. So from admissions, we will be able to get the wards and inpatient metrics. Our interest is that we want to admit our patient to the labor ward. So we will select among the wards we have configured within the facility. This is a training that we're going to do in depth to the labor ward, and it will populate for us the patients who are currently in this particular labor ward. Let's just give it some time. And also access it from the inpatient metrics. From the inpatient metrics, our interest is to look at the labor ward, where we have so far around 19 beds, 18 of them are occupied, and we have 1 free bed. So within the labor ward, a minute as this loads. So anyway, let me just explain so that it loads, it will be easier for us to be able to see. So once you're able to access the labor ward, we will have the option of seeing patients who are waiting admission, and we can be able to admit our patient to the ward, give them a bed, define exactly where the bed is within the ward. And from there now, we will have the opportunity now to offer them inpatient services. So within this particular inpatient section, we'll be able to select our patient, which will take us back to the patient homepage, which it can open quickly. And from there now is where we will be able to document the workflow for maternity. That's where we'll be able to even access the pathograph. Currently, we still have documentation for the pathograph. We are transitioned to the labor care forms, but they are still under review, they're still under piloting, so we'll still access the pathograph just to document the labor workflow and complete the other important forms during the delivery and during the inpatient care for our patients. So I'm hoping it's going to reload quickly. But we've been able to conclusively showcase how we are able to enroll our patients to different programs and what are the specific criteria for patients. And that was supposed to conclude that particular section. So as I work to see if it is going to refresh, we can showcase this later. Allow me to switch it to the next presenter so that we can move to the next section where we can look at machine learning first. Moses, you can proceed.
Thank you, Marianne. Please confirm that. Marianne, am I audible from your end?
Yes, Moses, you're audible. Yeah, just continue. You're audible.
Thank you. Well, yeah, for me, I think I'll just pick it up from where Marianne has left, and we'll be shifting gears slightly. My focus today, Alex, we'll be opening it up for Q&A, so please just hold on to your horses. So for me, I'll want just to take you through what we've been able to do with regards to machine learning in Kenya EMR. I hope to a majority of us we understand what machine learning is all about, and probably for those who are hearing this for the first time, machine learning is simply put, is a subset of artificial intelligence that focuses on just building systems that learn and improve as they consume data. So the system that learn and improve based on the data that they collect. So in Kenya EMR, we're also utilizing machine learning in two aspects. One is in the HTS testing algorithm, and two is in what we are usually refer to as ML in IIT. Simply put, machine learning in interruptions in treatment. So why interruptions in treatment? It's because in HIV treatment, interruptions in treatment is a big risk because it can lead to so many other. It can lead to us reversing all the gains that we've made, either to a patient or even as a country, with regards to trying to combat the HIV/AIDS pandemic. Because it's one of the causes of drug resistance. It can lead to, an increase in transmission risks and so many other things, including death. So allow me to quickly take you to what we have in Kenya EMR, and I'll go to the Kenya EMR modules, which is usually found on the top left corner of your screen if you are a frequent user of the system. So when you click there, I'll go to Kenya EMR Home. And then machine learning is one of the tiles available, and usually denoted by, I think, something like, the picture looks like something like a brain or something, I don't know. Yeah. So machine learning, before you can even utilize this, there are some things that you need to do. One is that you must have recreated and refreshed your ETL tables. For the purposes of this training, I'll not do that because it will take a lot of time, but I'm sure the next presenter will be taking us through some of the admin functionalities. So yeah, allow me to skip that, but allow that to come after I've done this presentation. So yeah, you will have to also synchronize. The first thing you'll do is to synchronize your data. So when you click on synchronize data, depending on the on your TX card or uh, the size of your database, it might take. I mean, it may take a longer or shorter time. So the duration that it will take to synchronize is dependent on the size of your database. So for example, all you need to do before you can do anything is to just click on generate patient scores. And as you can see, mine, it's kind of taking a longer time, still at 0%. So ideally, it's supposed to run. You are supposed to allow it to run until it completes that entire cycle. It gets to 100%. Looks like this is going to take us a long time. But what usually happens after the synchronization? Or the synchronization, in the ML summary part, this part here, you're supposed to be able to see, I mean, a summary of all the parameters for your particular facility, including the total number of patients that have been synchronized, those who have been classified as high risk, those with a medium risk and low risk. And for all of those parameters, again, you have the ability to just drill down to a line list where you'll be able to identify which of my patients have probably been risk as a high risk. And for each of the patients, again, it will take you to their patient homepage. So for the purposes of that, you'll just in the interest of time, you'll allow me to just stop the generation. But I think you've seen what you need to do. So in the event this finishes, you can still update the summary. Click on the update summary to just be able to update the patient summaries into the patient profiles, so that when you go now to the patient profile, you're able to see the scores. So where do we find the scores for the patients? I think we all know how to navigate back to now. This is the legacy user interface. So we all know how to navigate back to the 3.x interface. By clicking on the Kenya EMR icon there, it should be able to take us back. So let us give it some little time so we can go back. Yeah, looks like it's a heavy DB, but yeah, we'll surely certainly get back. All right, I've tried to fast track that. Yeah, so you will be able to get back to your home. I mean, to the current UI that we currently use, and probably just drill down to your patient. For example, I'll put my patient here to try see if they have anything to show. Um, so I might just check them in quickly so that I am able to navigate their patient profile. Well, and then now you come to your patient summary. Under your patient summary, again, as you were shown yesterday, I mean, the patient summary is divided into about 7 broad categories, where we have the patient summary, the vital and anthropometric, the care panel, immunization relations, appointments, and attachments. But for our interest, I want us to go to care panel and just click on care panel. So under care panel again, you'll see that it's been broken down into I think 3 other categories. So there's the panel summary, there's the program enrollment, what we've just been showed by Marianne, and then now the machine learning. So from here, that's where you're supposed to, if the patient has a risk, this is where you're supposed to come and just see their risk score. And I mean, that will prompt you now to take action. Again, one thing you should remember is that this is just a pointer to what the qualification that the model has things about the patient. Sometimes the model might get it wrong on that particular patient, but these are pointers to the clinicians for them to just be slightly vigilant with this particular patient and ensure that I mean they're able to attend to their clinics and that they did not become an interruption in treatment. So basically, that is I think all that I had to showcase, and probably we can just pose our questions. And before I hand this over to the next presenter, just in the interest of time again, over to you, Ogutu.
Before Gutu, if you allow me, let me just finish up on that section because the system has refreshed so that we don't lose the team kindly.
Please proceed.
Thank you. So going back to our patients, whom we want to enroll to the labor ward, allow me to quickly check them in. So inpatient services, this will not mark. Then start a visit. So when you do that, I'm now able to access my form here. Let me just use it again from inpatient. From the patient homepage, inpatient submodule, we're going to make an admission request. So we record the admission request. It's a very small form asking for the inpatient disposition. We actually want to admit, so check on admit to hospital. Then admission location, that is where now we are aiming to send our patient to, should be the labor ward. I said, again, we said this is configurable. You will be able to configure your wards according to how your facility has been modeled. So when we do that, we'll find that now we have an admission request among our requests to the labor ward. And when we go now to the labor ward, go back to TaifaCare, we go to the admission section. For me to use this one, which loaded. Let me just refresh this. So when we go to the labor ward, we'll be able to see that currently we have 2 patients who are awaiting admission, and our patient is one of them. And we can now be able to take an action. One of the actions from here is to admit our patient or admit them elsewhere. If maybe wrongly we had requested them to be admitted to the female ward and yet they were supposed to be admitted to the labor ward, we can be able to select this admit elsewhere. It will give us now an option to select the correct ward. Allow me to remove this because we are not doing that. Again, we can also be able to use the same section when we're doing a ward transfer from the admission section. So for our patient who is maternity test today, we're going to take an action of admitting them to the labor ward. By doing that, the system is going to load for us the admission request form. The major complaints, we can just say maybe in labor, we can just pick something about labor. Something like prolonged unspecified labor. Select a doctor. I will only fill the mandatory fields. They will pay via insurance, maybe paying via SHA. Then we're going to select a bed for them. Where exactly are we admitting them within the labor ward? So I'm going to select a bed. So what it does, the system will populate for you all the beds available within the labor ward as you have configured them. So we will be able to see which ones are not occupied and which ones are currently occupied. You see a bed, I'll be able to admit my patient to. Looking for a free bed. We had one bed here. I don't know what has happened. Just quickly allow me to add one quickly. Again, this is configurable. You can be able to add beds within the system. This is a training for another day. I just want to quickly add a bed within the labor ward. So just in adding of that quickly, use a number that may not be available to a specific row. Bed column 8, the labor ward is available. The bed type, we can call it a VIP. Tag it as a bed. And we save. So we go back to my form now and choose the bed. I think it is refreshed. I will now be able to access an empty bed where I can be able, this one, labor bed, the name of the bed is labor 9. It's a VIP bed and it is empty, so we can use that one to admit our patient too. So when we do that, we'll get a successful message. Our patient has been admitted successfully to maternity. We no longer have our patient here among the waiting admissions, and we can get them from the admitted tab. Let me just to refresh that so that it moves quickly. So from admitted tab, we will now be able to locate our patients, maternity test today, and we can be able to perform several actions. So that means they're currently within the labor ward. So when we want to go back, the clinicians within the ward want to see our patient, they will come, select among the admitted patients, they'll be able to see the patient who's been admitted, and they will be able to access them from the patient page by clicking on the name, which is a link. It takes us back to the patient homepage. Then anything that pertains to inpatient services, they're going to access from the inpatient submodule. And now we will be able to see that from the inpatient details, we can be able to get some details about our patient, the admission. We'll also be able to see the days they're in ward, which exact bed have we admitted them to, which ward are they in, and we can now be able to access the inpatient forms from this section here. So we can be able cardiacs, the APD procedure, all these forms, depending on the time we are doing it. Now, because our patient is coming for labor ward, where do we access the pathograph from? So from from the patient summary, where we were accessing the care panel, I think, let me just try to reduce or increase? Yeah, just increase a bit. You will find several tabs. So it should be the last tab where we will access now the pathograph for our patient. Just give it a minute to load. Now we will be able to fill the details over time as they happen, and we will be adding, and the system can be able to give us a graphical representation of the indicators. For example, if you're filling a fetal heart rate, document by clicking on the add, loads for you a small form to be able to capture that. If you're documenting the membrane amniotic fluid molding, the cervix in terms of measurement, I don't want to fill the forms right now. We'll be able to add a document, and we'll still also be able to see the indicators as they are changing over time, and we can be able to visualize this in terms of graphical views or a tabular format. So we encourage the users to check this and use the pathograph as we transition to the labor care forms. So that's it. That was the bit that was remaining, just to showcase the changes. In case you want to enroll a patient to maternity for labor care, we have to do it from the inpatient section and no longer from the care panel section where we're enrolling them. It is no longer a program, but it is part of the inpatient workflow. So allow me to stop sharing. Now we can welcome the next presenter and we can take questions on chat. Welcome, Mobutu.
Thank you, Marianne, for that session. I just confirm that I'm audible.
Yes, Ogutu, you are. Proceed.
Let me just share my screen. Are you able to see my screen? Moses, are you able to see my screen?
Yes, I can see your screen. Thank you.
Okay, thank you. My session will be a short one. Can you do it? Take me through the technical manifestation of TaifaCare. When we talk about the administration tasks, there are quite a number, and I will not be able to cover all of them today because of time. Because some of them are quite involving. Just to mention a few administration tasks, we have system installation, whereby you can install the TaifaCare powered by KenyaMart from scratch. You can do system upgrades. You can do multi-tenancy setup. That's the new kid in the block. Currently, you can do system configuration and optimization. And when we talk about system configuration, that is where we have the bed administration. We have the stock management, management administration, whereby you figure the stocks. We also have DWAPI upgrades and configurations to enable data transmission to data warehouse. And then we have setting up of database backups and restore. So those are some of the admin tasks that we have, the most common ones, and we might not be able to go through them. So today, I'll just take us through the admin tasks, just a few admin tasks, and to access the administration page to view the tasks that are taken through. That is on ETL, administration and user management, and most probably we can check briefly on scheduler overviews. So to access the administration page after login, ensure you have the right credentials, that is the rights to access these particular features. So from the homepage, you can access the various modules about the administration module, whereby you want to look at ETL administration and user management. You click on the administration module, it will load for you by default user management. Under user management, you can always search for all the users that have been registered in the system. You can edit their roles. You can add them more roles. You can reduce their role depending on what they are going to do within the system. So in search, we have a search here. Just search by name. Can see Gachangi here. Try to okay, so it will give you options. Those whose names fall within the text that you've typed, it will load for you and you select the correct. So when you expand, it will give you more information concerning this particular user, the phone number, the addresses, the ID. If they are providers who are licensed, it will give you the license number, the registration number, the status, whether they're expired or they're still valid, those particular licenses for the providers. On the right, under actions, we have the buttons whereby you can edit the user. When you click on edit, you should be able to edit the demographic information, the login information. We have the provider account, again, in case you want to update for all users who are existing in the system and you want to update their details in terms of license number, the registration, and you can as well sync the same with the registry to ensure that you get the most accurate information in terms of the most current status of their licenses. So you can also add additional roles to these particular users, and when done, you can always save and close. So that is that. From this particular user administration page, you can also add new users. You can onboard new users using the add new user button here. When you click on it, it will load for you the blank user registration form. You capture the national ID details, if there is a regulator, if it's a clinician or a nurse at the regulator, and when you select the identification number. When you enter the identification number for the regulator that the user, the provider is assigned, when you search, it will pull from the registry and load the information in terms of status of their licenses, if it's still valid or invalid. And in any case they're invalid, they're not able to process claims. So this is very important. Under demographic information, just key in the names, the phone number, email address, the sex, and all that information. The login information, whereby we have the username, the login credentials, whereby you can always allow them to change their credentials after creating, or they retain the one that was created. Under provider account details, so this is what will be populated if any case you synchronize this with the registry. And you'll be able to load the license details and every details for this particular provider. In any case they don't have, you won't be able to populate this because you use their registration number to do it. This is also the section where you can make a user to be a provider. Remember, we have users and we have providers. You can be a user, not a provider. And being not a provider, you'll be limited to what you'll be able to do. You won't be able to see, to attend to black patients or do some other activities. Under roles here, so this is where you assign the administration roles. In any case, the user is an administrator. There are various roles. We have the billing roles. We have the clinical roles. Remember, TaifaCare powered by KenyaMara is role-based. So if you are given role for an adherence counselor, you won't be able to access orthopedic roles. So depending on your role at the facility, you'll be assigned this by your system administrator. We have the record roles, various roles here, and then we have the investigation roles. If you are a radiologist, lab tech, or you want to only be pulling the scores from the national data warehouse, you'll be able to be assigned the roles. We have pharmacy roles, and then we have the inventory roles. If you be working with the stock management, you'll have to be assigned various roles depending on what you'll be doing within the stock management section. So when you're done with that, just save and close. So this is where you do the assign the roles. And for stock management, there are additional roles. After being assigned the inventory roles, there are role slots that will also be assigned depending on your location and also the tasks or operations you'll be undertaking under that. So I will be able to see that briefly. Unless there are any questions and user management, you can always raise your hand or have them chat. I'll be delighted and I'll be able to respond, or my colleagues will be able to respond on the chat. On ETL administration, this is where we recreate the ETL tables. We've made it easier for those who are having difficulty creating ETL tables. If you want to run the cost and videos, encourage depending on your server features or the workflow that you have. Always run the ETLs when the clinic is not busy, so that you don't interrupt other users, because it's a little bit resource intensive and it might slow down the system if you run the ETLs while other providers are accessing the system and tracking patients. So under ETL operations, we have quite a number. We have the refresh tables, updating latest information you've captured to the ETL tables. We have the refreshing UAP tables, doing the same, refreshing UAP tables, updating those tables with the latest information that you've captured. Then we have the recreate tables, whereby we recreate the tables afresh, and then we refresh them with the latest information. We have the recreate data tools, and then we have the recreate facility-wide tables. If you want to run facility-wide reports, like OPD reports, you must recreate facility-wide tables for you to access those particular reports. Just a quick, I can recreate any of the tables here. I can refresh the facility-wide, and when you click on that, that is how far it gets. Even in case you have a super server, when you have a server with adequate resources, and also it depends with the workload, the amount of data the script has to load the information. So when it's done, you'll always get the completion status and the time, start time and end time, so that you can always monitor how fast the process goes. So that is all on ETL administration. So on locations, this one might not be able to cover, but this is the section where you can be able to tag your locations within the facility. If you want to tag the various locations, if you create a labor ward, you want to do the right tagging so that you access the various forms, this is where to do it. Sorry, it's quite dragging. If you can see the tags, the tags here, and various locations that are in this particular server. These are configurable depending on your facility setup. So you might not go into details on this, but this where you are on board new locations. In case you have additional locations that are not available within the system, you can always add them. If you have additional lab pharmacies, this is where you add them from, and you tag them accordingly. So you always get the location, and then you search for the location and give the right tags. Okay. Yeah. Briefly on facility details, this is whereby after configuring the correct endpoint for the facility, you should be able to synchronize this with the National Health Information Exchange server so that you can get a token and also facility details. This will enable you to search for clients from the registry using the ID. You saw in today's session or yesterday's session whereby during registration you key in patient's ID number, and then it pulls the details from the SHA portal, that is the HIE. So via the HIE, so the registration details will be pulled after you've synchronized the endpoints you have here with the central registry. So when you synchronize with HIE, you just click on this button. This had already been done, and you can see the details have been pulled here. That is the facility registry code, the SHA license number. It will tell you the SHA status of that facility. If a facility has been registered to offer SHA services, contracted, you'll be able to see the status here, and then the expiry date. This will inform whether you can get SHA services from any of the facilities. I think that is all from here. Maybe briefly, I talked about user role scopes for those who will be configuring the stocks. So maybe I can look at that briefly. So to access that, depending on the location, we have a manage stock module. When you're here, for additional roles, for anyone who will be undertaking operations within either the main store or the pharmacies or the various pharmacies within the facility. We have additional user role scopes. So these ones are additional role scopes to what we configured during user registration. So depending on where this user will be undertaking their work, you can always assign that. If I edit this, you should be able to see what is being updated. Okay, so we'll have the user. The roles are so many, so you can assign roles depending on what the user is going to do. And then you can enable the user or disable the user. If you disable this user will not be able to undertake any stock related operations. And you can also set the user to be a permanent user within the locations you'll be assigning the user, or if you have a temporary staff, you can always set the time when they'll be active, from which period to which period. When their term expires, automatically they'll not be able to access any roles for stock operations. So this one is being set here. And then now, which particular operations will they undertake? So you can select the operation depending on what they'll be doing. There are several of them. I think these are 10 roles. We have adjustments. You can only have a particular user to do adjustment, return, opening stock, or any of the roles, or all of them, depending on what. Then the locations. If you have several locations, you can only peg a user to a specific locations. And if you're an administrator, you can assign yourself all the locations that you'll be undertaking the above roles. So these roles will be pegged with a location that you'll be assigned. So when you're done, you just save it. And that is all from me. Thank you, and back to you, Marianne.
Buto, if you're speaking, we can't hear you.
Oh, I said that was all from me, and I returned back the mic to you.
Oh, thank you for that. Thank you for that section. We've been able to see some administrative tasks that we can be able to do within Kenya EMR. They may appear a bit technical, but remember these are done by trained technical staff, maybe your system admin, the ICT officers, and even designated HIS teams who will help you to configure, to perform some of these admin tasks, add users for you and all that. So you don't have to do this yourselves. And this should be done before the system is in use. So quickly, to wrap it up, allow me to quickly share how now we can be able to access program-specific reports. For this one, we are just going to do a highlight. So within Kenya EMR, so from Kenya EMR, we can be able to access the Kenya EMR modules. From Kenya EMR modules, one of the modules we currently have is reports, so we can access our reports from here. When you do that, it will load for us all the reports we have at a specific program. So when you enroll a patient to a specific program, you can also be able to access specific program reports. For example, we have common reports that you can be able to access that involves some of the donor and MOH reports that are even required for monthly reporting. But just looking quickly at what we've covered today for specific forms, we can be able to get HIV-related forms from the HIV tab. That is patient line lists, registers that we use to report, and even to query our data within the facility and help us to make decisions. For the PrEP program as well, we can be able to get program-specific reports. We can be able to get all our patients who are currently initiated on PrEP newly and those who are currently on follow-up. And we can even be able to see even the new regimens that we're giving our patients. When we come to specific reports, especially in the MCH, we can be able to access MCH mother reports, the ANC register, the maternity register, the postnatal register, another line list that will also help us. Again, from the child welfare clinic, we'll also be able to access that. Then among the new reports that we have that cover the entire facility, you can also be able to access specific reports from data that is even coming in from the OPD section and from the other section. From here, we can also get specific reports that are more related to a specific program. For example, we can get the family planning register. We can be able to get the outpatient registers. We can get reports like FCDRR, FMAS from this particular section. So we encourage users to also integrate within this new version of Kenya EMR, the TaifaCare version, and give us feedback. Generate the outputs, but remember, Kenya EMR will only give you what you have input into it. So let's look at documentation. Let us look at the workflow. Let us orientate ourselves. Let us orientate the users on the ground, the people who are documenting using this particular system, so that you can also be able to give us the correct output. So we would want to end the session here today. In the link from the messaging section, we have shared our link where you can be able to access documentation, our SOPs and guides that will guide you as you're conducting your CMEs, as you're engaging users. You have targeted trainings within specific departmental workflows. You can also be able to access our training instances so that you don't have to use the database we have at site because you may need to use dummy data. You can just access the instances. We've shared even the login credentials. So thank you guys for making time today. If there are any questions, somebody would like to raise a question, you can just raise your hand and we can have a small Q&A session. We also appreciate the users who've been asking questions in the chat area and the Q&A, and the team who is also supporting us to answer those questions. So the floor is open. If you want to ask a question, you can raise your hand. If we don't have any question, anybody would like to ask a question, let us continue to the chat area. We can also utilize the Q&A. As I said yesterday, we have a community of practice where we aim to learn from each other. You can be able to ask a question there and somebody can be able to answer and assist you. So if we do not have any questions, we want to wrap it up for this particular session of virtual sessions, training for 2 days. Be able to engage more. We are going to come up with more virtual sessions and encourage you to ensure your users log in. So do we have a question? Somebody, Jane, you can unmute from your end and ask your question. Kalama, can proceed. Sandra, if you can go to question. Okay. I'm saying maybe you can proceed if you can be able to unmute. We cannot be able to hear Zen. We can also not be able to hear Kalima. Let us utilize the chat area and the Q&A area. So this, it seems like we have a communication breakdown from the people on call. We can't hear you, but we've managed to answer most of the questions that have been raised in the chat area, and we can continue to engage there. At this point, we can end the session, and we acknowledge much appreciation for you joining, for mobilizing your team to join, and taking time to come for this particular training. Thank you so much and have a lovely